far as we know, and from the reports internationally as well as from our Singapore patients, the predominant features include fever, cough, and then some of them of course get nasal congestion and a little bit of runny nose. There are also some reports of diarrhea and vomiting. So this is very much in line with what's happening overseas as well. I think the complications, thankfully, so far in our local experience are rare. But overseas, there have been reports of course, pneumonia and even leading on to multi-organ failure. There are rare complications as well. There's an evolving situation of the pediatric inflammatory multi-system syndrome. So basically a overreaction of our immune system that results in multiple organ systems being affected.
The incidence of COVID is much higher in adults and in the older population. The number of children being affected by COVID is much lower. They find that the children's immune system is better and therefore they are more resistant. We really do not see very much the horizontal transmission, we call it. That means if you're in a childcare center, you don't see one child passing to another child. They also find that the children who are actually infected are usually infection from mother or father or grandparents in the home. So it's usually household transmission. So, and also in children, the disease is usually much milder. However, of course, recently there is a write-up by Europe, United States and UK where they describe this thing called the COVID, the cytokine storm, where they present the KD-like or Kawasaki-like disease in the older children or the young teenagers. So this one we do not see in Singapore, we do not see in China or even in Hong Kong and Taiwan. So there could be some genetic variation in the disease manifestation. So generally up to now in Singapore, the disease is relatively mild in children.